Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today's episode is going to be great, but I want you to think about this: a locker room dream, a rehab room reality, one moment that changed everything. Today's guest, Dr. Joey Scambia of Renaissance PT and Performance, shares how the injury that ended his playing days became the foundation for the clinician he is now. Before we jump into this episode with Dr. Scambia, I just have a quick message from our sponsor, Grow Solutions, where we partner to transform passionate healthcare practitioners into profitable practice owners without the overwhelm or guesswork. Grow Solutions eliminates a lot of stressors in the business, such as new patient or client acquisition, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs, and yes, understanding which AI systems agents to implement, because the bots are coming for us, whether we like it or not. So Grow Solutions is not an agency or vendor. We are your growth partner. So if you've ever thought or said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Feel free to reach out to me on any platform or drop the word in grow below, and we'll get back in touch with you. But you're here for today's episode, and that's with Dr. Scambia. So welcome to the Prime Health Podcast, Dr. Scambia. Please tell us a little bit about yourself and what you do.
Yeah, Derek, thanks for having me on. So my name is Joey Scambia. I'm a board certified specialist in sports physical therapy. And now I'm the current owner of Renaissance PT and Performance. I have my own clinic inside of a large gym called Fort Athletic Club up in Oceanport, New Jersey. And then just a little bit about kind of what led me to this part of my career. I went to physical therapy school in Rhode Island in 2021. Right after that, I went straight into a sports physical therapy residency down at Johns Hopkins in Maryland. And while I was there, they always send the residents down to IMG Academy because there's also Johns Hopkins All Children's Hospital down in Florida. So the residents get to go there and treat on IMG Academy's campus with the Johns Hopkins All Children's staff. So I was able to do that for 3 months during residency, had a great experience there. And luckily, the timing was right that when residency ended, I was able to go back down there and start my career there as a new clinician. So I was there the last three and a half years, basically doing all of the longer term rehabs from the student athletes that were on campus and some of the college and pro athletes that would be there, whether they were injured in season or coming to rehab in the off season. So it was a very cool environment, very multidisciplinary environment where we were surrounded by pretty much any discipline you could imagine. So it was myself and 3 other physical therapists, athletic trainers, strength and conditioning coaches, nutritionists, mental conditioning coaches. So we really had a very holistic team to where you can bounce ideas off of each other. Because I'm a big proponent of collaboration. If everybody's on the same page with an athlete that they're working with, or really any client in general, everybody's going to win. The client's going to win and all parties are going to win versus siloed approaches where everybody's trying to help, but things slip through the cracks and the client ultimately doesn't get what they need. So that experience really kind of shaped how I kind of view what good care looks like. Now I'm on my own up here starting an own practice, so I don't have those people under my roof right now. I do have the luxury of having personal trainers in the building, which is awesome to be able to collaborate with specific patient cases. But now my goal since starting up is to really start building local relationships with docs, with psychologists, with surgeons in the area, so that way I can kind of form that multidisciplinary team up here, even though it's not going to be quite the same as my experience down at IMG. So I kind of want to take the whole treatment model and philosophy that I was a part of the last three and a half years and bring it up here to better serve the athletes and gym goers that I work with.
Yeah, I love it. There's nothing wrong with learning where you're at and then taking yourself and planting and prospering in many ways. And it sounds like you've got a path that you said, this is a great program that I learned under, the people that were surrounded with me. And it sounds like that's what you're doing, is looking for those to bring small pieces of that to eventually get your own bigger place yourself, which is great.
Yeah, so it's been a great learning experience. Obviously, being on my own, I had to do things that I wasn't accustomed to thinking I'd ever have to do as a physical therapist, networking, strategizing, marketing, admin stuff, sales. So it's kind of just opened a whole new host of things that I need to now start learning instead of just, the clinical side of things. So it's been a nice adjustment and a nice challenge to kind of dive into things that I wasn't really accustomed to, just being like a staff physical therapist in the past.
Yeah. I want to jump back into what I kind of brought up in the introduction with you, but was there a moment in a life circumstance or anything that happened that you decided to choose a career in medicine and specifically in physical therapy and sports physical therapy?
Yeah, so I always had an interest in some sort of sports related job. I could never picture myself sitting at a desk. That's just not something that's ever jived with me. I've always been somebody who's been on my feet, played sports my whole life, fell in love with the weight room and just training process. So I could never really picture myself doing anything other than something in that realm. So I was first introduced to rehab in the high school. I had a herniated disc in my mid T-spine, which is a pretty strange spot to have that happen without any sort of significant trauma. So that kind of introduced me to the rehab field, and I kind of enjoyed the whole process of it. What really solidified my desire to pursue medicine, or specifically sports physical therapy in general, was my experience that I had in college. So I played Division I baseball at Northeastern University. Freshman year, I had a pretty nasty spondylolysis, stress fracture in my back, along with 2 disc herniations. So that resulted in a very long amount of rehab, a lot of symptoms. So rehab went well at school. I was able to rehab daily with the athletic trainer, continuing to be integrated with, my teammates in the weight room as much as possible. When I went back so this basically the injury happened during the season, so I needed further rehab once the season was over. Went to my local physical therapy clinic, and I felt like I really didn't get the overall attention or, appropriate program that I felt like I should have gotten given the demanding things that I needed to get back to. So I don't think it was necessarily the exercises that didn't make me prepared. It was just the fact that I was kind of doing the same, remedial table exercises for weeks on end with no gradual progression back to swinging, running, sprinting, lifting. So I felt better from a symptom standpoint, but from a preparation standpoint, there was nothing to bridge me back to those baseball related demands. So by the time I got back to school, I'm quote unquote cleared to go back to all the activities that, I thought I could go to, get back to school, get back into the lift routine, get back into the baseball practice routine. Boom, back is irritated again. And now kind of starts the whole cascade of that whole negative, mental component, negative physical component, negative social component. It's affected my ability to be involved with my teammates. My whole mental outlook on things has changed. And I really think if I just had gotten the appropriate plan in the beginning, where it's progressed week to week, where it's appropriately tested and scaled week to week, where appropriate outcome measures are used to assess mental readiness, like none of those things were done in that experience that I had. And looking back, I really wish I approached it a little bit differently, or kind of vetted where I was going a little bit differently earlier on. So that way there would have been much less of a probability that I would have ended up in that situation, because there was virtually no testing, no return to sport testing, no strength and conditioning principles, no, outcome measure testing. It was just like, okay, this amount of time has passed. You've done these lists of exercises for X number of weeks and you're good to go. So symptom wise, I was fine, but preparation wise, it wasn't even close. So it's no surprise that I ended up kind of back in the same hamster wheel of symptoms. And that ultimately led to, me not being able to think that I could mentally or physically do the things that I was previously capable of doing. So that kind of led to the whole athletic downfall, if you will, of my athletic career. So basically that kind of shapes how I view treatment and getting athletes back, because I know a lot of it's such a big part of their identity, and it basically is their whole life, especially if that's what they're doing. Once you can't do that anymore, it basically removes an entire piece of their life. So having been on it on the patient side, and now having the clinical knowledge to kind of tackle it on the provider's end, I feel like I've had experiences on both sides of the coin now, where I can really resonate with somebody who's in a similar situation and really meet them where they're at for what they need from a performance standpoint to actually get back to something, meaningful, that's physical.
Yeah, I would agree, Joey. The fact, unfortunately, that you had to go through a lived experience allows you to feel their pain, live through the mental anguish that an athlete has. And I'm sure that the return to play systems that you've put in place are unfortunately built upon and grew from where you had to have that struggle. So I think that your athletes and your general population that you see is so much better off, again, unfortunately, because of what you had to go through.
Yeah, and it actually led to myself and a colleague basically formulating a continuing education course surrounding athletic low back pain. And we've had 5 courses this year. We're lined up for 6 next year. So we've had about close to 80 plus clinicians attend these courses. And basically a lot of it in the beginning was built around my experience and my poor experience, and kind of how do we move beyond that and tackle that with a phase-based, return to sport test battery, where we're making sure athletes are, checking off the appropriate boxes before just clearing them when, a certain day on the calendar is hit. Time is obviously one piece of the puzzle, but if there's all these metrics and benchmarks that they're not hitting, we're not really setting them up for the success that they're going to need to be able to display when they're actually on the field. So this actually led to a passion project of forming a continuing education course to help other clinicians hopefully better serve the athletes that they're working with that were in similar situations as myself.
Yeah. I love that, taking action on, again, a situation that brought, you through a problem, you helping others to not do that, and then expanding that by teaching other clinicians to get to that point. So I commend you for that. Congrats on that. And I hope that's continued success for you. So that brings me to a point, like, from in your experience, Joey, does rehab tend to fail athletes that are whether they're active individuals that have lofty physical goals?
I would say in the traditional rehab setting, it already kind of puts them behind the 8 ball for a variety of reasons. Number one is just due to the clinic setup of many clinics, right? A lot of them don't have a ton of space in terms of like the ability to have space for strength equipment, space to run and jump, space to cut, space to perform any sport related activities. Number two, the constraints of some traditional systems force providers to see multiple patients at the same time, where that kind of forces people to unfortunately have to water down care from patient to patient, where they don't necessarily get the time or individualized attention that they need to make sure that they're actually progressing in the right direction. And 3, just sometimes I feel like as a profession, the lack of understanding of what it's like to push people really hard. Like, I'm a big proponent of training hard myself, so that way I know what it's like to work close to muscular failure, work close to working at maximal intent. So that way I know what it feels like. I can better resonate with what my athletes are potentially feeling. So I continue to try to train as if I'm still in college, so that way I can resonate with what my athletes are going to be experiencing and feeling. So if they do have a complaint or a certain comment during an exercise or during a session, I can much better tap into what the provocative factor or what might be going on, versus if I didn't have that experience, I feel like I wouldn't be able to fully make the appropriate tweaks or changes to their program if I weren't going through something similar myself. So I feel like those are 3 major things that make it tougher for the athlete going to more of your traditional, clinical model to get the true, care that they need to get them over the hump. Because like I said, most clinics do a really good job of getting people past that pain point, which is great, but being pain-free doesn't necessarily mean you're ready to actually perform or compete at a high level. So I not only want to get people out of pain, I want to get them out of pain, plus be able to blast them past whatever physical, milestones or goals that they have. So that way I know that they're actually ready from like an objective measure standpoint.
I was online checking you out yesterday, doing a little bit of watching some of your socials, and you had a video, I think, of prepping somebody post ACL. So what does an effective return to sport testing actually look like, let's just say, for an ACL client in your case?
Yeah, so I feel like return to sport testing is kind of all the rage, which is great because it's kind of shifting in the direction that we want to, with people using more objective criteria. But the thing I want to make clinicians weary of is that return to sport testing, or return to sport, the process, is an entire continuum. It's not just a single day in time. It's not like an isolated test day. Return to sport, like beginning that preparation process, begins the second the injury happens, right? We already need to start figuring out which stakeholders are going to be involved. And that's going to depend on who they're seen by. Are they going to be in a hospital-based system where, they have surgeons, they have orthopedists, they have ATs, they have PTs under one roof? Are they going to be in a private practice where they might only have PTs under one roof and might have to collaborate with other providers elsewhere? So number one, just getting an idea of what stakeholders are going to be involved right from the beginning is going to be huge. So that way we know who we have to communicate with and keep everybody in the loop on what that athlete's dealing with. So kind of where they rehab is going to be a big factor as well. And then 2, making sure we're slowly scaling and checking the appropriate boxes. So, We can't do our return to sport testing if swelling is still high, if mobility is still restricted, and if work capacity is still kind of not where it needs to be. So we need to attack that foundation first. We're not going to move up the pyramid if the bottom of the foundation isn't where it needs to be. So while these necessarily aren't return to sport tests, if we don't have those kind of achieved, it's going to make our ability to pass those return to sport tests significantly more difficult. So while those benchmarks in and of themselves aren't actually tests, if you will, like in the literature, they're still kind of tests in my mind because we're achieving those foundational benchmarks that allow us to then tap into the things that are higher up on the pyramid that require more mobility, more stress, more work capacity. So that's kind of number two. And then number three is choosing tests to test different things, right? So we have our handheld dynamometers. That's mainly going to test kind of our peak strength and torque to body weight ratio. So for example, with that ACL case you mentioned, so if somebody's about 16 weeks, we want to make sure that they have the adequate limb symmetry from a quad strength standpoint, right? So we test them with their handheld dynamometer, knee extension seated at 90 degrees isometrically. Okay, are they within 70 to 80% symmetry? If we check that box, that still doesn't necessarily mean they're ready. You could have 70 to 80% symmetry, but if that non-surgical leg is still way below where we're looking for from a peak torque to body weight standpoint, that's still not going to be good enough. That's basically running on 2 flat tires versus 2 tires that have a lot of air in them, right? So limb symmetry is one piece of the puzzle, but peak torque to body weight is going to be another piece of the puzzle, right? So just because they have 70 to 80% limb symmetry, we want to see how hard they're kicking in relation to how much they weigh, right? So if somebody's kicking out and they weigh 200 pounds and only kicking out 100 pounds on their surgical leg, on their non-surgical leg and 50 on their non-surgical, we know there's a ton of work to do because even that non-surgical leg is nowhere where it needs to be from a peak torque to body weight standpoint. So kind of those tie in together, having appropriate limb symmetry, but also the appropriate peak torque to body weight to show that they can kick out the appropriate poundage for their weight. So those would be kind of one area of things to look at where we can focus on like max strength. The other would be more of like rate of force development or reactive strength. And those we can get a little bit more from like force plate type data, right? Jump height is one piece of the puzzle, but the strategy that they're using to get to that particular jump height. Let's say we're doing a counter movement jump or single leg counter movement jump, left versus right. 2 limbs can have the exact same jump height, but the strategies to get that height could be totally different. Let's say the surgical limb, they're spending much more time on the plate. They take longer to descend. They're going through a lot less counter movement depth on that side versus the other side. They're going through more counter movement depth. They're comfortable loading that quad rapidly from an eccentric standpoint. They're spending a lot less time on the plate and their flight time's a lot better, right? They have 2 similar heights, but totally different movement strategies. And those are things that you wouldn't be able to detect just by doing like a seated knee extension isometric with a handheld dynamometer. So that's where kind of strength is one piece of the puzzle, but we also have to look deeper on the rate and reactive strength side of things to know if somebody can actually express that rate at the forces in the times and at the magnitudes that we actually need them to. So it's kind of utilizing a variety of tools to get the data that we want. It's not just measuring things for the sake of measuring things, because then it's just kind of all signal. We need to be able to actually find the noise, like tune out the noise within the signal. So I feel like a lot of people just get data to get data, whereas we need to get data, but we actually need to pick the appropriate metrics that are going to guide what we're going to do from a programming standpoint. So that's kind of how I view return to sport. And then the last thing I want to hit on is even the things that we do that aren't tests, I view them as tests. Almost every exercise or intervention that I give somebody, while it's not a return to sport test, I'm assessing what it looks like, how it feels, what their symptoms are, what their movement strategy is. Even though it's not a return to sport test per the literature, it's still giving me a lot of valuable information for when I actually do that formal return to sport test. I should already have in my head a general idea of what that movement is going to look like because they've already practiced or done something similar from an intervention standpoint several dozen, if not several hundred times. So if they do perform that return to sport test and it looks terrible or way different than what I thought, then I probably did something incorrect in my programming or I didn't prepare them efficiently to handle that specific return to sport test, if you will. So that's kind of how I view that whole process from injury to picking the right metrics to having exercises also serve as tests.
Yeah. Well, I can tell you that you are hands above a majority, if not, you're in the 1% of how you address your athletes and your individuals that come into your practice. And I'm sure you learned that from, being at IMG and your approach and what you've been educated in school, because all too often at big boxes, just like in a hospital setting, and I don't mean hospital with physical therapy, I mean hospital with a patient you're not going to see primary care, it's time. It's a time factor. I'm sure you still have time that your patients are in there, but you're addressing from day one, you said, looking at them from what's it going to be like when they're released. And each exercise that you go is a little bit of a step into what they need to be doing at the day of release when they're done. So I appreciate that. My son has unfortunately gone through 2 ACL tears, ruptures in the same knee 2 years in a row. So I can see that there's a difference in your approach versus others. This isn't against it, but your knowledge base, your clients have such a better outcome possibility than some that are in big box physical therapy companies. So again, I want to commend you for how you're approaching that with your patients. I think is great.
Yeah, and I definitely don't fault the PTs a lot for this. A lot of it's just due to like the structure of the setup. So like you said, time becomes a limiting factor. If you have, one or two other patients, even 3 other patients in the same room, there's no way you're going to have time to set somebody up, in 90 degrees of knee extension, running them through the test battery, running through them, the verbal cues, assessing it, analyzing it, and explaining it to your patient. If you have several other patients in the room at the same time, it's just not possible. So it puts other clinicians in a tough spot because that's just unfortunately the nature of a lot of traditional settings. But I do think we're starting to move in the right direction, at least with getting more people to objectively test. Because in my opinion, it should be a non-negotiable, especially if somebody's getting back to something high level or requires a lot of force physically. We need to get some sort of tangible data that a manual muscle test is definitely not going to provide us. It's as something that's listed as objective in PT school, it's as subjective as it can possibly get. When you have people of different sizes interpreting things differently, like someone's 5 out of 5 can be interpreted way differently than my 5 out of 5. So that's where the handheld dynamometry takes all that objectivity out of it. And luckily now they're making of devices that are super affordable. I don't know if you're familiar with Tindeq, TINDEQ. It's only $150 to $170. Great opportunity to get real objective testing into multiple clinics for a very cheap price point, rather than having to drop several grand on a subscription-based dynamometer or, an isokinetic device, which most people definitely don't have. So they're definitely lowering the bar on getting into at least objective strength testing. And, I believe if any clinic is willing to invest in that, like it's a no-brainer to spend $150 to get real data on your patients than $10,000 for an ultrasound machine that typically collects dust in the corner. So if given the option, I'm taking that $150 dynamometer 100 times out of 100.
Yeah, that's good. As we're kind of discussing this, trust is extremely important when patients are selecting providers. So what would you say are questions that athletes should consider asking their providers before they, it's not necessarily a second opinion, but what questions should the athletes be asking their providers to make sure they're going to the right provider for their care?
Yeah, I think this is a huge educational piece, not only for athletes undergoing physical therapy, but for really any healthcare encounter. Like even myself, like I want to know who I'm working with, kind of what they've done in the past, what their ideal clientele is, what their experience is with certain pathologies or populations. So, just as much as people would vet a surgeon cutting them open, I'm an advocate of vetting the person you'll be rehabbing with just as much as the surgeon you'll be working with. So this doesn't mean, scour the internet and try to find everything on them. Just asking the clinic a couple questions about, their process, I think can go a super long way to know that you're probably in the right spot. So that's something I try to relay to a lot of athletes. Like when you are injured, like one of the most important decisions you can make is where you choose to rehab, because similar to my scenario, where you go can have major ramifications on the outcome that you're looking for physically, mentally, emotionally, socially. Like it doesn't just affect the physical, like it affects so many other components as well. So my big piece of advice for people who are injured and need to potentially pursue care is calling the clinic or even visiting the clinic that you're thinking of going to and just asking a couple different questions. I think the biggest one is, how much one-on-one time do I get to spend with my physical therapist? 15 minutes versus 30 to 45 minutes, that's a big difference in the amount of one-on-one supervision you'll get before potentially being passed on to an aide who, no offense to the aide, doesn't necessarily have the doctorate level of experience that the physical therapist does. Number two, how often, or will I be seeing the same physical therapist every time, right? If there are many clinics that kind of pass patients around, which a lot of things kind of have to slip through the cracks because the patient winds up telling their kind of whole story to a new therapist every single time. And it really kind of waters down the congruency or continuity of care if they were just to be seen by the same provider the whole time. Number three, how many patients will be in the same room as me while I'm getting care, right? If it's going to be 3 or 4 other patients at the same time, which happens in other places, that should automatically be an antenna that, hey, I might not get the attention that I need to get over the hump with this particular injury. Another one I like patients to ask, what space or equipment do you have? Are the pink dumbbells and yellow TheraBands going to be enough, or do we need some weights over 50 pounds, some kettlebells, some trap bars, some barbells, some turf space, some plyo boxes, some hurdles, some sleds, things that are actually going to prepare you for the demands of the sport. And I think the biggest question that should answer the question for the athlete is, can I perform one of my normal training sessions in this clinic? If the answer is no, you're probably not in the right spot to get you to where you need to be physically. And then I think the most important one is, how do you determine when an athlete is cleared to return to sport? So getting an idea of, one, do they even have any sort of test battery? And two, what does it look like? So if it's just based on feel or number of visits or when insurance visits are met, that's probably not the route that you want to go, versus these are the benchmarks we look at. These are the tests we utilize. This is the data that we use to inform our decision-making. Okay, these are the clinics that I want to gravitate towards because they're using real data and key performance indicators that make sure that my son, daughter, athlete, whoever is going to be cleared appropriately versus just subjectively on time or number of visits. So that would be my biggest piece of advice to anyone pursuing anything in healthcare, is just make sure you're asking the appropriate questions, and it'll save you a lot of, wasted time, money, travel, being in the car, going to all these different clinics. If you were to just take the time, vet where you're going to go, ask those questions, and then you'll have your answer.
Love that answer. It's you're giving advice for a clinician to make sure that you want to make sure that your athlete that's coming in, or that patient, is going to be motivated enough to do the workload that you put on them, because not everybody is that way. Just it's not the case. And then you're giving your eventual clients, hey, these are questions you can ask me, or go and ask a big box company that has 3 letters in front of their, in front of their company's name. Do they do the same things? And you and I both know that they don't. So,
yeah, and I've even had several clients who wound up not working with me, but I'm happy to point them in a direction by giving them, I almost give them a little mini handout of those questions. Okay. I don't care who you necessarily work with. Obviously I'd love to work with you, but if I don't work with you, at least let me point you in a direction to where you're not going to run through that financial, physical, emotional headache of ending up in potentially one of those spots where you're not getting the attention or progressive care that you deserve. So anybody, I'm happy to send those over to you if you need kind of guidance on how to tackle, your rehab situation. It doesn't need to be with me necessarily, as long as we're getting you to the appropriate spot or the appropriate provider who can get you from A to B. That's going to be my ultimate goal.
Yeah. What would you say are the top 3 conditions or athlete type injuries that are entering into your practice currently?
So a little bit across the board since I've started up. It's only been 3 months, so I've kind of seen a little bit of everything. But definitely down at IMG, biggest one was definitely ACLs. We saw a ton of ACLs across really all sports. There was no real trend of soccer had the most or football had the most. It was pretty spread. I would say out of all the sports that had the least, baseball probably the least, but every other sport, tons of ACLs. We saw a lot of spondylolysis, a lot of stress fractures in the low back. Same thing pretty much across the board, and a lot of, elbow shoulder with the baseball population. So I would say knees, post-op knees, low back, stress fractures, and then shoulder elbow pathology, specifically from, volleyball, tennis, baseball, where, the overhead demands are insanely high.
Yeah. All right, let's talk about your business a little bit more here. What are you focusing on right now as far as your business is concerned?
As far as my business, just building that brand awareness and that I'm new to the area. So just getting more one, providers to know that kind of I'm there to collaborate with them and kind of support them and bounce ideas off of them. And two, just kind of let people in the gym and local area know that I'm brand new to the area and have these services devoted specifically to athletes and gym goers. So like even on my website, like my main headline is like sports physical therapy for athletes and gym goers. So I want it to be almost foolproof that if somebody stumbles upon my social media or my website, like they know exactly who my services are tailored for, to where there's no confusion, no real questions that need to be asked. Like they go to the site, they go to my Instagram, they go to my Facebook page, LinkedIn page. Okay, this person works with athletes and gym goers. So my goal is to try to answer those questions before they even turn into questions. So more so I'm in the raising awareness type stage of business, not only with the potential leads and clientele, but with local providers that I can work alongside with.
Mm-hmm. As you started out, you said 3 months in, what's like the biggest challenge you felt you've overcome so far in practice?
Definitely building that initial awareness, because I'm one, brand new to New Jersey, and then two, I'm brand new to a large gym. So it's kind of a double whammy being behind the eight ball, given that nobody whatsoever knew who I was. So really just getting that first client was just a huge weight off my shoulders to say that, hey, my service actually, results in people wanting to pursue it. So that made me, feel super, super positive that this has something to potentially scale. And, each month I've gotten several more clients, and it's slowly just ramped up month to month. So even though I'm still super new, like I'm in an ideal spot from an expectation standpoint at only month 3. Definitely not where I want to be quite yet, but I've definitely exceeded where I thought things were going to be at for the month 3 mark, given that nobody knew who I was in the area.
Yeah. Sounds like you're a diamond in the rough, but people are starting to see the shine come through a little bit of the dirt that's out there. So that's a good thing. Yeah. So I'd love for you to share a success story that really stands out to you for some of the patients you've worked at, whether it's here at your current clinic or maybe even down at IMG.
Yeah, so I want to share one story of a patient that I just discharged. Local hockey player was dealing with some TFCC kind of owner wrist, significant pain that was preventing him from shooting, bearing weight, gripping heavy things, obviously affecting his ability to play hockey, since you've got to be able to do most, if not all of those things. And the way my model is structured, it's a hybrid model, meaning patients come in person a certain amount per month, so as little as once a month, or as much as once every other week, or as much as once a week. So that model is kind of be conducive based on clinical severity. So if someone's clinical exam isn't super significant, probably don't need to come, every single week, and probably push it out to once every other week or even once a month. And then depending on what we determine from an in-person standpoint, they're always going to have a supplemented remote coaching implemented into their plan of care as well. So everything is uploaded into an app where all the videos of all the exercises I upload, all sets and reps, all exercise cues and comments I upload, and then they kind of carry out their rehab plan on their own with the ability to communicate with me on the days that they're not with me in person. So if an exercise doesn't go too well, or they have pain or any sort of question, they can send me a video. I can coach them through the exercise. I can change any specific, variable or variation of the lift if they have pain or discomfort. So it's a way to keep them really accountable and communicating with me a lot in between sessions. Whereas with your traditional kind of, we finish PT Tuesday, I'll see you in a week, there's no touch points in between. Yeah. I wanted to fully get rid of that, where they have full access to me, basically me in their pocket every other day that they're not in physical therapy in person, to where they're still able to get what they need from a rehab standpoint. Because a lot of how I view things, really good rehab is just slightly altering what they're doing from a training perspective and communicating really well. If we can do those two things really well, someone does not need to come to me 2 to 3 times a week for 8+ weeks. So I only saw this kid 3 times in person over the course of 2 months, with the rest of rehab being entirely remote. And we got him back to full participation in hockey. He's back to full gameplay, no pain with shooting, no pain with gripping, lifting. So I think that just goes to show that, a combination of in-person, low frequency in-person, plus really good progressive remote coaching with a lot of communication can really get people the result that they want without having to spend so much time, driving to and from the clinic. Good rehab can definitely be done in other ways that are out of like that traditional norm.
Yeah, you definitely are breaking the traditions and how you're approaching that, especially with the results that you got with only 3 in-office visits. Typically in the big box, it's 3 office visits per
Whole
week
week.
for
Yeah.
4 weeks. Yeah, it's see me because I'm your way to do this. But again, I think that goes to the point that you bring up, Joey, that you had to make sure that that client, this young athlete, was going to fit well in your model. If he didn't, if he or she, whomever it is that's in there, isn't fitting that model of willing to take active care and an active role in their rehab, it's not worth it, because that number it's not going to work out for them, and it surely isn't going to work out for you either.
Exactly. And that accountability / compliance piece is huge, because so many of the people that I've talked to that have said, oh, this PT didn't work or these didn't work. But then when you dig into a little bit more about compliance or consistency, like those are usually non-existent. So it's hard to say that PT didn't work if the compliance and consistency wasn't there. So that's purposely why I built in the remote side of things, because I'm almost forcing the accountability. Like if I don't see they've logged anything, I can just message and be, hey, what's going on? Are you sick? Is there pain? Are you traveling? Like, what's up with this week? And then I could see at the end of the week when I send a check-in, I'll send a variety of questions. What was your compliance with the exercise program? Rate it 1 to 5 this week. If it's a 2, I'm going to ask questions. Hey, why was it a 2? What can we do next week, or how can we better structure this following week to get it to be a 4 or 5? How are sleep, stress, nutrition, 1 to 5? If those are off, compliance is off, okay, we're probably taking a little bit of a step back, or we need to maybe have a conversation about how we can get those things to be a 4 or 5. So checking in with that also gives me a ton of information on how I can better tailor my treatment to them, or kind of meet them where they're at with kind of how they're answering their check-in questions.
Yeah, love it. Total benefit for the patient and for you as a clinician taking care of them. So I loved everything you shared. Just a couple of questions here as we kind of end up. So if people are interested in learning more, we're going to share all of your links so they can get in touch with you. But what would you say is the easiest way for people to get in touch with you and learn more about you and your practice?
Yeah, easiest way is definitely Instagram. I'm pretty active on there, joeyscambia.dpt. Feel free to shoot me a message. Happy to talk shop about whatever, whether it's questions, rehab stuff, clinical stuff, non-clinical stuff. Happy to always, make connections. Like I said, I'm newer to the area, so the more connections I can make, not only locally, but, nationwide can help as well, because at IMG, kids were going all over the country for Christmas breaks and spring breaks, and they always need providers. So happy to make that connection. If you are working at a college or a high school or a university where kids are traveling back to the Northeast or the Jersey area and need assistance, happy to facilitate that connection, or vice versa. So even if you're not local, like definitely reach out to me on Instagram, and happy to collaborate or network however I can.
Okay, fantastic. Thank you, Joey. Last question here. Since you're on the Prime Health podcast, what would your definition of Prime Health be?
Yeah, so it kind of goes back to what we talked about before, not necessarily only being pain-free, but being pain-free, but being able to tackle whatever is thrown at you physically. So there's kind of the distinction between health and performance, or not. I wouldn't call them the same thing, right? If you do something performance-wise, you're probably going to be very hyper-specific with what you're doing, versus health, it's probably a little bit more generalized. I kind of want to be in the middle of that, where I'm a little bit more specific with what I'm doing, but not so generalized to where it's not getting me closer to the athletic goals that I want. So basically being able to be in a good place where I'm not having symptoms, I'm able to do everything what I want to physically, but also be able to do everything from an athletic and performance standpoint that I'd like. So kind of finding that happy medium between health and performance is kind of what I would define that as.
Yeah. Love it. Thank you for sharing that. I appreciate it. I love asking that question just because it's unique for every single person that's out there, and everybody can benefit from, whether you're a provider or whether you're a patient or, someone walking the street. So Dr. Scambia, I really want to say thank you very much for sharing your insights with us today. You've got very unique perspectives from, unfortunately, what got you into healthcare, your path through healthcare, being around some of the leading experts in the area, now starting that own in your own practice. I think that that's great. Now, I always tell this because I think it's very important. If from our viewers or listeners that are out there, if there's one thing that Dr. Scambia said, please share it to somebody else. We'd love it to be shared with as many people as possible, but let his knowledge help that one person take their rehab to the next level, because it's important. There are too many people that are out there that aren't getting the care that they need. And I think that, as you can hear and see from what Dr. Scambia had to say, his message and how he approaches rehab is fantastic. I'd always say as well, please subscribe to our Prime Health podcast. It's important that we get this message out to as many other people that are out there. But I always end this with, so until next time, remember that your true wellness is a journey we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Scambia, thank you very much for being a guest on the Prime Health podcast.
Thanks so much for having me, Derek. Appreciate it.